This is Dr. Shakil Ahmed. Today I want to discuss the solid nodules of the breast tissue and its characterization using ultrasound modality. The solid nodules are considered worrisome and observed for malignant findings. If even a single malignant feature is present, the nodule cannot be classified as benign. If no malignant features are found, specific benign features then need to be sought. The nodule can only be classified as benign if benign features are found. If specific benign features are not found, the lesion should be classified as intermediate. Breast cancer is a heterogeneous disease. A single nodule can have heterogeneous makeup. If suspicious lesion is identified, ultrasound is expanded to the entire breast for evidence of intraductal components, multifocal diseases, and multicentric diseases. Axilla is scanned for abnormal lymph nodes. Multifocal breast cancer denotes of two or more lesions in same quadrant of the same breast, while the multicentric breast cancer denotes two or more cancers in different quadrants of the same breast. Malignant findings. Individual ultrasound criteria are as follows. First of all, speculation and echogenic halo. The lesions are taller than wider. We mean for large anterior posterior dimension. Angular margins. Marked hypoechoic as compared to the fat. Shadowing. Calcifications. Duct extension. Branch pattern. Micro-lobulation. This image shows a malignant mass. First of all, it is hypoechoic. Second, it has irregular shape. It has speculations, angular margins, and also duct extension is appreciated. Some microcalcifications are evident. At the same time, we can observe the architectural distortion of the tissue surrounding the lump. Now we will discuss the sonological characteristic of malignant mass of breast tissue. First of all, the speculation and echogenic halo. Speculation corresponds to invasion of surrounding tissue and is host response to the lesion. Speculation manifests as alternating hypo and hyperechoic lines that radiate perpendicular to the surface of the lesion. Hypoechoic components represents either fingers of the invasive tumor or ductal carcinoma in situ component of tumor extending into the surrounding tissue. Hyperechoic components represents the interfaces between the spicules and surrounding tissue. Spicules are present as purely hyperechoic or hypoechoic depending on the echogenicity of tissue within which the lesion lies. How to scan? Entire lesion is scanned in two orthogonal planes. Speculation may be present only in a small part of the lesion. Echogenic halo around the lesion is further evidence of speculation. Halo may appear thicker along the lateral edge of the lesion because the perpendicular angle of speculations relative to the beam provides better reflector than those from vertical or parallel orientation to the beam. In the case of very small lesion, the thick echogenic halo may be the prominent feature. In this diagram, it is shown that how the speculation will appear. These are the speculation arising from the irregular mass. There is a halo surrounding the mass with speculations. This is another image which shows the invasive ductal carcinoma. In this image, we can find many malignant features such as thick echogenic halo, speculations, irregular shape, angular margins, hypoechoic or the hypoechogenicity, and also showing posterior acoustic shadowing. Benign lesions grow parallel to the tissue planes, while malignant lesions grow perpendicular to the tissue planes. This is reflective of the potential to invade across normal tissue planes. The stiffness of the lesion relative to the surrounding tissue and the orientation of the terminal ductule in which the lesions arises. Lesions that are larger in the AP dimension than horizontal dimension are more suspicious for malignancy. Taller than wide is associated with smaller, less than 15 millimeter malignancies. When the lesions are becoming enlarged, this ratio will be distorted. Another feature is angular margins. Angular margins are identical to the jagged or irregular margins seen on mammography and are the most accurate of all ultrasound findings for malignancy. Angular margins represents ultrasound finding indicative of invasion and are most frequently and easily demonstrated as the point at which a Cooper ligament intersects the surface of the tumor. The angles of the lesion margins can be acute, right angle, or obtuse. They may be present in both speculated and circumscribed malignant nodules, or may be the only suspicious finding. A single angle of any type on the surface of the lesion should be considered suspicious and should exclude the lesion from being labeled as probably benign. Angles on the surface of the nodule occur in regions of low resistance to invasion. In this image, we see an irregular hypoechoic solid mass having a taller anterior-posterior dimension as compared to the horizontal diameter. This image shows the angular margins. When the tumor enlarges, It grows into the base of the Cooper's ligament, and therefore it is causing to assume an angular shape. The key to identify the angular margin is to identify the echogenic Cooper ligament, follow it toward the surface of the nodule. In this image here, these are the Cooper ligaments. The Cooper ligament, if it is followed to the surface of the lesion, there will be the angular margins, and this is very much characteristic of malignant lump. This is another image showing a solid hypoechoic lump with irregular outlines and hyperechoic speculation, and there is also angular margin. This is the Cooper ligament which is followed coming toward the lesion, and here the angular margin is very much clear. This mass is typically malignant mass. Another feature of malignancy is marked hypoechogenicity. The hypoechogenicity of solid nodule as compared with the fat is suspicious for malignancy. This is largely due to increased water content, necrosis, or secretions within the lamina of the tumor distended ducts. Shadowing is suspicious finding that suggests presence of invasive malignancy. Acoustic shadowing occurs in approximately 1/3 of all solid malignant nodules. Breast cancer can be internally heterogeneous. Only part of a solid malignant nodule might give rise to acoustic shadowing. Calcifications. Presence of calcification is suspicious finding. Calcifications occur within the lumen of ducts distended by ductal carcinoma in situ. They are usually associated with other suspicious findings such as duct extension or branch pattern. Calcifications are considered a soft finding. They appear as small, bright echoes with no acoustic shadows. Duct extension and branch pattern, also considered a soft finding. Duct extension as an isolated finding is more likely to be a benign papilloma. However, further workup is needed. Duct extension is seen as a single projection of the solid growth toward the nipple from the main nodule. Branch pattern is different from duct extension in that the pattern manifests as projection of the solid nodule into multiple small ducts away from the nipple. Micro-lobulation. Micro-lobulations are 1 to 2 millimeter lobulation that vary in number and distribution along the surface and within the substance of the nodule. Micro-lobulation can be seen with both invasive ductal carcinoma and ductal carcinoma in situ. The size of micro-lobulation correlates well with the histological grading of the tumor. High-grade lesions tend to have large micro-lobulation. Low-grade lesions are having small micro-lobulation, while intermediate grade lesions tends to have intermediate micro-lobulations. This image shows microcalcification appeared as clusters, which is non-shadowing. In these microcalcification are well corresponded to the microcalcification identified first by mammography. And after that, the ultrasound guided biopsy confirmed the diagnosis of DCIS. This image shows the extension of the growth toward the nipple in a large duct, while the growth is also extended toward the smaller duct away from the nipple. These are the micro-lobulation which are present in the outline of the lesion. This is called micro-lobulated lump or lesion. Thank you very much for watching this video about the malignant features of the solid nodules. Another video will be followed explaining the benign features of solid lumps or masses of the breast. Thank you.